The first study I did was looking at traumatic memory recall in patients with a history of chronic early life trauma. And what we found in this study is that people can have two very different types of responses. About 70% of people had a flashback response during which they actually relived the traumatic memory of their childhood abuse. And the other 30% had a depersonalization reaction. For them, the memory was so intense that they had to disconnect themselves from the emotional content of the memory, and therefore described sort of leaving their body, looking at themselves from above while recalling the traumatic memory. And then we really wanted to compare and contrast what happens in the brain during these two very different types of responses to traumatic memory recall. When we first started doing this traumatic memory recall study, we were scanning a patient with a history of chronic early life trauma, and our prediction was that all the patients, while recalling their traumatic event, would have a flashback response with an increase in heart rate. But while we were scanning the first subject, what we saw was that while recalling the traumatic memory, the patient's heart rate actually went down. And so after the scan, we got a very detailed description of what the patient had experienced. And what she told us was that she had a classic depersonalization response in which she removed herself from her own body and sort of was watching herself from above to disconnect herself from the emotional content of the memory.